Hi, good morning, everyone. Thank you all so much for joining us today. Hope you're doing well. I hope you're staying cool and staying hydrated. And let's just hope that we don't have rolling blackouts, so that we can have this panel discussion here today. But welcome. My name is Megan Klink, and I'm the CEO for Susan G. Komen, Orange County. And just at Komen, Orange County, we are endeavoring every day to empower breast cancer patients and caregivers with personalized information and improving access to high quality health support and advocating for strong public policy and fund innovative disease research. The fight against breast cancer is absolutely not canceled just because of COVID-19. And that's why we're here today. We're going to be discussing questions and anxieties around dealing not only with a breast cancer diagnosis, but doing so in this new pandemic environment. We hope that, yes, you will leave this panel discussion today feeling inspired, but also with some truly practical tools for how to manage a diagnosis, how to advocate for yourself with your provider, and really focus on some pandemic-specific tips, as this new environment certainly has brought new challenges for everyone, in particular around screenings and in-person visits. Today, I'm thrilled and honored to be joined by breast surgical oncologist Dr. Hang Dang and medical oncologist Dr. Wade Smith, both from City of Hope, Orange County, one of Komen's proud healthcare partners. Dr. Dang and Dr. Smith practice at City of Hope, Newport Beach, the first phase of City of Hope's expansion into Orange County. We're so happy they're in our community. And we're also going to hear from April Jones, who will talk about her personal journey with breast cancer and her strong connection with her medical provider. As many of you know, City of Hope is home to some of the nation's leading clinician scientists who are transforming laboratory breakthroughs into treatments that offer the best hope for patients. City of Hope opened its Newport Beach location earlier this year, and it's a safe place for world-class cancer care, providing access to a roster of hematologists, medical oncologists, and surgical oncologists who possess unique cancer experience. We are so proud to partner with them to bring invaluable breast health educational opportunities and panels such as the one we're having today to all of you and to the community at large. And before we get into today's discussion, I really want to encourage all of you to post your questions in the comment section. We are going to take 15 minutes at the end and try to address as many of your questions as we can get to. So please feel free to type away. But let's get started. I'm so happy to introduce to all of you a wonderful individual whose strength and perseverance serves as an inspiration to us all, April Jones. And April was diagnosed with breast cancer in June of 2017 at age 30. This was just a year after her own mother was also diagnosed with breast cancer. They both chose Dr. Dang, who we're going to meet later, as their physician. So welcome. Thanks so much for joining us, April.
Hi, good morning. Thank you so much.
April, can you tell us what it was like to go through cancer at the same time as your mom? And what was it like sharing the same physician?
Going through cancer at the same time or right after my mom was pretty bittersweet. We had just finished celebrating her 1 year of being cancer-free, and then I found a lump in my own left breast. So I went through the motions of, being so afraid to lose my mom, and then I got hit with cancer, and it was like, I was so afraid of my daughter losing her mom. So that was the hard part. And then I feel like there was a moment where I was given these two options, and it was like, okay, am I going to go through this thing kicking and screaming and asking, like, God, why me? Why us? Or, am I going to choose to believe that somehow this was all set up so that I could be familiar with, what a double mastectomy looked like, what, constant doctor visits looked like. And also I got blessed with a really good doctor like Dr. Dang. So I chose to believe that that this all happened, for a bigger purpose. And so it was comforting. And I feel like it's such a mama thing to, go through cancer before me so that I wouldn't have to go through it alone. So it was bittersweet.
Yeah, absolutely. But it sounds like you were able to find a way to have a perspective about it that helped you get through that. So that's really remarkable. Can you tell us a little bit more about your diagnosis?
Yes. So I had just turned 30. I was a new mommy. I was breastfeeding and I found a lump in my breast. I eventually got diagnosed with stage 2, grade 3 invasive ductal carcinoma. My cancer was hormone positive, HER2 negative. I ended up doing 16 rounds of chemo. I chose a bilateral mastectomy because that's what my mom had chosen, and I was familiar with that. I also did 5 weeks of radiation, and I had a few reconstruction surgeries, but I chose to go flat after all. And I am currently on a monthly injection, and I take a daily hormone suppressant pill.
Thank you. Thanks for telling us more about that. Well, I know, April, is there a message that you want to share with other women who are potentially at the start of their breast cancer journey?
I have 3 messages for women who are starting their cancer journey. Number 1 is you're going to feel like you're not in control over a lot of things, like your cancer or your diagnosis. I want you to remember that you're in absolute control of how you respond to it all. Your attitude, I feel like perspective is everything. So you don't have to wait necessarily for the light at the end of the tunnel. You can poke holes through it. And I know this sounds very cliche, but try to find the joy in the journey, because that is a game changer. And number 2, something that my dad, who was also diagnosed with cancer right after me, always reminds me is live in the moment. We worry so much, and unfortunately, worrying doesn't add another minute or second to our lifespan. It's a thief of joy, and I feel like we waste so much time worrying about tomorrow that we ruin our present moment. So I would encourage you to live in the moment. Also, worrying is really bad for your immune system. And number 3, which is the most important one, you are your best advocate. You always will be. So be proactive about your health. Stay on top of it. Treat your body as a temple. Feed it good foods. And also, you know your body best. So if you feel something, say something, and look for doctors like Dr. Dang and Dr. Smith, who are going to take their time to listen to your concerns and provide you good support.
April, thank you. This is a good message for every single one of us. Really important and inspiring. And April is going to stay on and join us all for the first few questions of our panel discussion, as we really talk about the impacts of COVID-19 on patient care and the important conversations between patients and physicians. So if you have specific questions for April, please do also put those into the chat. But at this time, I am so excited to welcome Dr. Dang and Dr. Smith, who practice together at City of Hope, Newport Beach. Just a little bit about them both. Dr. Dang is a fellowship-trained breast surgical oncologist who focuses on the treatment of benign and malignant cancers, breast disease, and her area of expertise includes image-guided breast biopsies, nipple-sparing mastectomies, intraoperative radiation therapy, and oncoplastic breast surgery. Dr. Smith is a board-certified medical oncologist who is passionate about treating breast cancer. And he has spent the last 7 years specializing in breast health and cancer treatment, serving patients in Orange County and beyond. Thank you so much, Dr. Dang and Dr. Smith, for joining us. We are going to take some time to talk today about facing cancer in the midst of COVID-19 and how to navigate decisions with your physicians and hear your recommendations for screenings and treatments. And so everyone, please join me in welcoming Drs. Dang and Smith, and just another reminder about putting your questions into the comments section. Well, thank you both for making time. I know you don't have time, so this is incredibly important for all of us to have you here. And before we get started into the heart of the discussion, I think it would be great if you both could just take a moment, share a little bit more about yourselves. What led you to become a physician, and why did you choose oncology? Dr. Dang, can we start with you?
Yes, thank you, Megan and Komen, for allowing me to participate in this wonderful event to educate the public. And April, thank you for joining us and sharing your story. You've been a fantastic patient, and I'm actually very glad to be a part of your cancer journey. I want to kind of tell you a little bit about myself. I was exposed to medicine at a young age when my dad is a OB-GYN. But the main reason I became a physician was really to help people. And I chose to focus on breast cancer after an interaction with a patient during residency. She had advanced stage breast cancer in the hospital where I saw her, and was very unaware of the extent of her diagnosis. And at that time, I was trying to choose my path. And this was just an incident where I was able to realize that my path was to go into breast cancer and oncology and educate women. She'll never know how she impacted my career, my path, but I think I'm grateful for the path that we crossed and how we are able to help each other. And now I'm able to help guide women like April and her mom through their breast cancer journey and give them hope.
Thank you. Thanks so much. Dr. Smith?
Thank you, Megan. And I also want to thank Susan G. Komen, Orange County, for having me on. And thank you to April for sharing her story. This really just helps to create the picture. I've always been fascinated in health sciences, biologic sciences. A microscope was my favorite toy as a kid. And all through college and medical school, it really became apparent that oncology, medical oncology therapeutics was hitting a boom in terms of what was being produced. And it was in medical school when a drug, trastuzumab, really demonstrated itself as being a big game changer in helping patients with HER2-positive breast cancer live longer. And so that was seamless. I went in to train within medical oncology at my institution. We had great thought leaders, one of the original hereditary cancer geneticist, Henry Lynch, and then I was inspired by other people like Dr. Ruth O'Regan. And so I found breast cancer to be kind of a wide open area to make a difference. And so certainly that's how I'm continuing forward at City of Hope. You know, the nice thing about City of Hope, a lot of things are in-house. We're able to do bench-to-bedside research and get drugs to the patient very quickly. And so that's my focus, as well as also answering some of the other questions with regard to psychosocial wellness and all the other aspects of providing comprehensive care.
Thank you. Well, I think that we're all incredibly grateful that you both chose the path that you did, and very much appreciate the work that you do. Well, Dr. Dang, can you talk to us about how has COVID-19 impacted cancer care and changed the way that physicians interact with and care for patients?
Well, COVID-19 is one of the most unprecedented healthcare challenges in generations. And nationally, cancer screening has dropped almost 94% during March because of COVID. And the American Cancer Society also surveyed and found that 87% of cancer patients and survivors had disruption in their care during COVID. What we're here to say is that Seed of Hope continues to care for patients, and the disruption are very minimal. There are only certain changes that we have implemented to help the safety of the staff and the patients and their family. So for cancer care, we continue to provide world-class cancer care to patients, and we continue to encourage patients to make sure that they get the treatment that they need, because cancer doesn't stop because of COVID. So we are able to implement certain safety precaution for patients under regulations and rules that are national. And patients are also able to use telemedicine. We have implemented telemedicine to help them connect with the physician in their home, and allow access for them to have discussions with their physicians. And I would say that I encourage patients to feel safe, to go to cancer centers that allow patients to get the care that they need, and not feel and not increase their risks in any way.
Mm-hmm. Thank you. And April, this would be a good chance for if you could weigh in on what your experience has been like through COVID, and how has that impacted how you interact with your physicians, whether that's in person or virtually.
So so since I do a monthly injection, I was due for an appointment when COVID first started, and naturally I was very nervous. I did not know what to expect. The news had shared that there was like a shortage all around the world of masks, and I was just very, very nervous. So I decided to bedazzle my one and only N95 mask. And so, I said a prayer, I showed up, and it all was good. It was, I had so much anxiety, and when I went inside, they did the screening, they had masks ready for me to change into. Everything was super clean. Nothing looked like how I expected it. I was very nervous. I had a lot of anxiety, and everyone was so kind. Everyone was so nice. My bedazzled mask was definitely an icebreaker, and that's kind of what I was hoping to provide. I felt like everyone was, in my head, I felt like everyone could be a little nervous, no one knows how to navigate it. So, but I had excellent care. My nurses did not, everyone had a mask, they had extra mask, and my nurses were so wonderful to me. And so I go in every month, and I look forward to going. I feel safe. Dr. Smith can't get rid of me. I'm just kidding. So it doesn't, I would encourage people to not stop going to see your doctors during this COVID. Everyone is safe, and it feels good to go in and be proactive at the end.
That's great. That's good to hear. Bedazzling solves many problems. And I think we're just going to move ahead because I'm concerned about time. And so, April, you can stay on for this one. I think Dr. Smith and April, it would be great to hear your different perspectives on how can patients better navigate conversations with their physicians to understand their treatment options. And love to hear Dr. Smith's perspective, but then April, if you can weigh in, especially regarding how important building that good rapport with your physician. So, Dr. Smith?
Yeah, thanks, Megan. So April is a perfect poster child of what we like to see for patients who come into the office. She always has her questions, prepared. And, she deals with what all of our patients have, a level of anxiety that needs to be channeled in a way that's very very productive, and she does. And so I say, come with a list of questions. Come with a visitor. Obviously, we have restrictions now. Everywhere does with regard to visitors. So have them on the phone ready to go. It helps to have an extra set of ears, somebody to take notes, so that you can just kind of focus on absorbing what you can absorb. Especially for a first-time consultation, patients are kind of like a deer in the headlights, and so they'll walk away retaining maybe 20%. So I think that would be the most essential. It is a team, and whoever a patient can bring with them to their office appointments makes a huge difference.
Thank you. April, anything to add?
Yes, I sometimes would ask Dr. Smith if I could record because by the time I got home, I would be like, what did he say? Are you sure he said that? So my sister would play it and be like, okay, he did. Everything's going to be, so I would encourage that, especially now since, no visitors are allowed. And
oh, go ahead.
And I think it's very important to build that good relationship with your doctors. I know it was very important for me because I knew I needed to not feel like I was just a statistic. And I knew I needed a great and honest team to root for me all around and to go like hand in hand through this road with me, because I feel like they do. They're there every step of the way. And I'm honestly just so grateful for Dr. Dang and Dr. Smith, because they listen to my concerns and they take their time and they provide me with genuine hope. So I'm super grateful.
That's fantastic. Well, thank you. Thank you so much, April, for joining us and sharing your perspective. It's incredibly valuable to hear from you. And we're going to let you sign off for now, but don't go away, because we're going to bring you back when we do the Q&A from the comment section. But Dr. Smith, we're going to stay with you and would like to hear what measures hospitals and cancer centers are, like City of Hope, are taking to ensure that patients stay healthy if an in-person visit is needed.
Yes, certainly. So, we have a system-wide operation where we follow CDC guidelines, as well as I follow ASCO guidelines and NCCN guidelines, as we all do. And, I think what's important is strict health screenings for anyone entering the building. We take their temperature, we ask them the right questions, making sure no recent fever, no recent contacts, loss of smell. Early identification of who is suspected of being infected or has infection, so that we can, appropriately focus care where we need to and isolate who we need to. And then we have a no visitor policy, which is universal within City of Hope. And again, that is very important with regard to social distancing within the premises. And in addition, our staff, our clinical staff, 100% trained. They know what to look for, and our environmental services do an excellent job keeping the facility clean. And we're also doing other things, expanding telehealth. We find that that's very helpful. There are those patients who need to be seen. They're either going to receive a treatment, we need to do a physical exam. By all means, we need to have those patients come in and see us. Other visits can be telehealth arranged. And there are other things we do too on the treatment end. We can extend catheter flushes out to 3 months. We can give growth factor support for a lower cutoff for patients at risk for developing infection, all the sorts of things we do to accommodate the times that we're in right now.
Great, thank you so much. That's incredibly helpful to know. There's a lot of different options out there. We're gonna kind of move away from some of the COVID-19 related questions, and Dr. Dang, what do you recommend when people ask what they can do to reduce their risk of breast cancer?
So there are certain risks that you can't really change, such as your age, your genetics, your family history. But there are certain risks that you can change, and usually that's associated with life modifications. Get plenty of exercise, 30 minutes a day would be beneficial. Eat a healthy diet, proteins, fibers, nuts, reduce the fat content. Stay away, avoid smoking. We know that that's a big component for cancer. And reducing alcohol. Unfortunately, alcohol is known to increase risk of cancer. That doesn't mean that you can't have any, it's just limit the amount, and you can still enjoy, your wine daily if that's what you enjoy. But that's something that is important. But the most important thing is preventing breast cancer is what is important in the first place. And so reducing your risks and understanding your risks is very important in breast cancer prevention and treatment.
Great, thank you very, very much. And this question is for both of you, and it's actually, it's about how important is a second opinion. And my mom, who is also a breast cancer survivor, this was something she really struggled with. She had a lot of anxiety around getting a second opinion. So would love to, and I know that's not uncommon. Would love to hear what you both think about that.
So you certainly, you can.
Go ahead.
Okay, so yeah, I see quite a few second opinions as a breast cancer specialist, and I think it is highly important because there are, uncommon types of breast cancer that the community oncologists who don't specialize may not recognize. There are uncommon presentations of common forms of breast cancer that, again, benefit from having a subspecialist weigh in on how to treat. And so I think it's very important, especially at the very beginning. It also allows for peace of mind. And I will say that, community oncologists are receptive to this. It's become the norm. It's become the standard for patients to go and render a second opinion that they then can bring back to their community oncologist. And I'll pick up the phone and talk to that other oncologist or not. I sometimes impart just the information the patient asks for, and they then can go back to their primary oncologist. But the norm is we communicate. We as oncologists within the community and within academics, we remain together in terms of providing that comprehensive level of attention.
Thank
you. Anything else to add?
Yeah, I would agree that there's various subtypes of breast cancer, and so there's cases that are straightforward, but there are cases that are very difficult. And it's always good to know that you have that second opinion so that you know the different treatment plans or options that are available that might not have been discussed about previously. And I also feel that sometimes patients feel like, do I really want to get a second opinion because am I going to offend this surgeon or a doctor or medical oncologist? And I don't think they should think of it that way. They should think that the physicians that they choose would want them to feel comfortable and want them to know that the different options are available. The second opinion allows them to confirm diagnosis. Sometimes it actually helps them to absorb the diagnosis because they had some time to think it through from the first opinion. So I do recommend patients to look into considering second opinion if they have any question whatsoever of the first opinion.
Great, thank you. Thank you both. Well, I'm just being mindful of time, but I wanted to, before we get into the Q&A, because we haven't yet touched on metastatic breast cancer. And Dr. Smith, do you have a message for our metastatic thrivers?
Yeah, certainly. The paradigm has changed. We look at metastatic breast cancer as a chronic condition, much in the same way that certain patients with lupus or other chronic inflammatory conditions are going to have a condition that will be with them for the rest of their life and will require some level of maintenance therapy. And that holds true for really the majority of metastatic breast cancer patients. So I would argue that that's the attitude to go into it with. And a couple other points I'd like to make. When patients first get diagnosed, knowing where to go is important. I've had many patients who, instead of seeking out conventional oncology care, may go to an alternative medicine practice, and they may remain with that practice for some period of time. And I've had them come to me a year and a half, 2 years later, where I can recognize, had we been involved from the onset, that would have made a big difference. So I would argue if you know someone or you are that someone who has found yourself within an alternative medicine practice as your first provider, at minimum seek a second opinion from an oncologist, board-certified oncologist. And we can always integrate recommendations, what we would call integrative medicine, through the journey of metastatic breast cancer treatment.
Great, thank you very much. And we do have a moment before we're supposed to get into our Q&A. So Dr. Dang, can you talk to us about why the breast cancer rate is higher in Orange County than the national benchmark?
Most likely associated with either demographic or lifestyle choices in Orange County. About 40% of women in Orange County is over the age of 45. And we're expecting in 2040 for it to be 50% over that age. And breast cancer screening occurs at the age of 40. And so it actually is reasonable why there's a higher rate of cancers in Orange County. Again, lifestyle has something to do with it as well, and demographics.
Great, great, thank you. Well, before to Dr. Dang and Dr. Smith, before we move into the Q&A, anything else that you feel that we need to share today that we haven't covered already?
So I think one of the most important thing is discussing cancer diagnosis with family, because there is an association to genetic mutations that can occur, and it's important for that individual to go get individual risk assessment and determine where they lie and what other screening is available for them. So I think that's very important.
Absolutely.
And I would add also, you know, we find ourselves in the time of COVID-19 where we become more of a cloistered society. Patients aren't, you know, getting out, socializing. And one thing I see with regularity are patients who do present with a neglected breast cancer, a cancer that may be at the point of involving skin, that they've done a very effective job in concealing from their partner, from their friends. And I think it's just all the more important now that we're adapting to this new lifestyle to just kind of reach out, follow up with our friends, you know, ask them about are they maintaining their screening, and do so in a way that will circumvent the kind of denial mechanism that's behind what we see.
Mm-hmm. Absolutely, so important. Well, thank you both. And April, if you can come back to us now, we're going to get into some of the questions that we've seen from people tuning in. And April, the first one is actually for you from Richard. And the question is, April, what did you focus on to persevere when you encountered trials and maybe news that was upsetting?
I definitely focused on the Lord. I focused on Jesus. I prayed a lot. It isn't easy, I would say, but you know, everything worth having is hard work, and that includes peace of mind. So that really helped me during all this. And also, you know, bedazzling a lot of stuff and making every accessory work for me. Thank you.
Thank you. Thank you so much. And we have a question also from Linda on Facebook, and this is for our doctors. And this is a three-part, so let me put it all out there, and then you can decide how you want to address it. And that is, I know that there are several kinds of breast cancer, but which one, if any, seems to metastasize more frequently than others? Or is it that metastatic breast cancer is a stage of breast cancer that has already spread to other parts of the body? And is there one in particular that seems to be recurrent more often than others?
I can start and answer that. Yes, metastatic breast cancer describes a cancer that has escaped the breast and has wound up in other parts of the body, either the liver, the bone, the lung. And by and large, we consider this a condition that's not curable, but we can treat. And, you know, with respect to what type of breast cancer that most risk for recurring, you know, we used to think, for some of you familiar with the nomenclature, you know, triple negative breast cancers, HER2 positive breast cancers were always the more aggressive breast cancers with a higher risk of recurrence. But we now know through looking at gene expression within the cancer cell that that's a good differentiator of higher risk cancers. We also know that cancers that respond well by giving chemotherapy before surgery, that's a good differentiator in terms of who's at higher risk.
Anything to add, Dr. Dang?
Yeah, different types of tumor will determine metastatic components as well too. You know, ER positive cancers usually metastasize to the bone. You know, HER2 positive, triple negative, lung, liver. So it is tumor type that we look at, and it's not just one particular tumor will be the one that will metastasize, but it depends on location and tumor type.
Great, great. Thank you both. It's very, very helpful. We have a question. This is a very good one for everyone from Emily. What age do you recommend women start to get their regular screenings? And what if breast cancer runs in my family?
So I can start with that since I see a lot of high-risk patients. Normal age is usually 40. I know the American Cancer Society also says 50, but we've advocated and we've seen so many patients in their 40s. So I still recommend at the age of 40 to start screening. If there is a family history, we do have to take a look at the individual patient's risk. And if a patient's first degree relative, mother, sister, daughter with breast cancer at say age 40, then that individual should start screening at age 30, 10 years prior to. If they were diagnosed at age 50, then the normal recommendation would be at 40. But I really think it's important to, if there is a family history of breast cancer, that individual undergoes a risk assessment and make sure that mammogram is not the only imaging that they can use. They can also use ultrasounds, MRIs, whatever is appropriate based on their risk assessment.
Thank you. Anything else to add, Dr. Smith?
No, I think that's a perfect summary.
Okay, perfect. And so a follow-up to that same question from April on Facebook, not our April here. How do you know if I have dense breasts, and what changes can I expect in my annual screenings if I do?
So dense breast is based on the images on the mammogram. You can't really feel the density, even though some people examine the breast and say, oh, this feels dense, but really it's just thickened tissue. And density is defined on imaging. And the radiologist is the one that will determine which category of density you follow under. There's 4 categories: fatty, scattered glandular tissue, heterogeneously dense tissue, and extremely dense. So the heterogeneously dense and extremely dense tissue have a higher risk of having cancers that are masked, that are not seen on mammogram, and those are the patients that we recommend additional imaging such as ultrasound. So it is very important for patients to understand that dense breast tissue does have a higher risk because that it's harder to evaluate on imaging. And those are also the patients that sometimes we recommend 3D mammogram. And 3D mammograms allow them to pretty much take a picture of the breast and slices, and have the radiologist view those slices to reduce the risk of recalls, calling back for an abnormality. So 3D mammograms is usually recommended in patients with dense breasts as well.
Anything else?
I would agree. Also, MRI is a helpful modality.
Thank you. All right, and we have from Matt, what are some steps women can take to maintain their breast health? But a follow-up question to that would be, do guys need to worry about breast cancer?
Yeah, so men do need to worry about breast cancer. And even though it represents 1% of cases we see, we do see it with regularity. It's typically age-related. Men probably have higher risk in terms of stage for stage risk of recurrence, but we manage men in pretty much the same way in terms of once diagnosed. But from the standpoint of being aware, yes, there should be increased awareness among the male community. Do you feel a lump? You should go in and have it evaluated right away. We don't, we as men, we don't have screening mammograms. We don't have any other way except just being attuned to, what we notice.
Thank you. Well, and anything else to add around what steps women can take in terms of just maintaining their breast health that we haven't covered already? From all 3 of you.
I would, sorry, Dr. Ding. I would just encourage women to, there's this little movement to feel it on the 1st. So, every 1st of the month, it helps you be on track to feel around your breast and your clavicle and under your arm. And that's something that you can do to be proactive and feel like, you know, you're on top of your health. And yeah, I think that's a good number one step to do. Sorry, go ahead, Dr. D.
I agree. I think that self-awareness, you know, if you don't examine yourself, you will not be aware. You know your body best. If you continue to evaluate and examine yourself, then you know that if there's something wrong, there's something different, to get it evaluated. So I think that's very important. You know, you have to take your own health in your own hands.
I would agree. I think a lot of women have anxiety. They say my breasts are very lumpy. I don't feel comfortable examining myself. And you know what we tell them is they're not really searching for a lump. They're basically becoming familiar with the landscape of their breast. And if anything seems new, don't hesitate to bring it to attention. It's a very simple matter to see your primary care provider or one of us if you're under the care of an oncologist.
Absolutely. Well, and we would love to hear, you know, this is from Lisa on Facebook. We're very excited that City of Hope is finally here in Newport Beach, but is there is City of Hope coming to any other part of Orange County?
The answer is yes. We're planning on additional sites similar to the Newport Beach facility, but in addition, we are on the cusp of opening a cancer hospital in Irvine, the 5 Point area of Irvine, which will have meet the needs with regard to inpatient care, as well as procedures, as well as medical oncology. And it's our ambitious $1 billion undertaking to provide care within Orange County to obviate the need to have patients leave Orange County to render subspecialty expert care outside the area. We're very excited about that.
Absolutely, that's incredibly exciting. Well, I think for our last question, so it's a good one, and it's for April and our doctors, and this is also coming from Facebook. What recommendations do you have for women that are nervous about their first mammogram? We hear this all the time at Komen. What are your tips? Yeah, so go ahead, sorry.
Tips. Ultimately, I think knowledge is power. So, you know, it does take just do it is what I want to say. Do it, being courageous or being brave. I heard that word a lot. And it doesn't mean that you're just like, oh, okay, I'm brave today, I'm not scared. No, just do it scared, but do it, because at the end of the day, knowledge is power, and you want to know if you have a tumor or you have a mass or if something's up. You can get treated, and like Dr. Smith had said, you can get treated early and have way different results. So I would just say, do it scared, and knowledge is power.
That's great. Anything else to add, doctors?
No, I think April said it best. Go in there and just bite the bullet and just do it, and then you'll be happy when you walk out that you're proud of yourself, that you actually took the effort and stepped into doing it. It is scary because it's the unknown, not knowing how the mammogram works or how the cold paddles that is on your breast and compressing on it. And people say that men created a mammogram to squeeze a woman's breast, but I get it. It's hard, but that's the only modality that we have at this point. I'm hoping in the future that they develop new technologies to allow us to evaluate patients without having them feel painful or scared or afraid of the procedure, because that's not what we want. We want to make sure patients are comfortable when they're actually doing it. And I think another point is that go to a center that does routine mammograms all the time, because the technologists that are there, the physicians that are there are actually knowledgeable in how to position it to make patients feel more comfortable. So I think that's another important point.
Excellent, excellent. Well, in the minute that we have left, we have just one last question I think we have time for, and that is, can you talk about immunotherapy when it comes to breast cancer treatment?
So certainly, we at City of Hope have we have clinical trials that incorporate immunotherapy as well. There has been FDA-approved immunotherapy for certain subtype of breast cancer in the metastatic setting. And what it really allows us to do is basically enable a patient's immune system to recognize cancer cells that had previously been cloaked and hidden from the immune system. So, for instance, one class of medicine we use called immune checkpoint inhibitor allows us to do exactly that. And we find that when we combine it with a moderately dosed conventional chemotherapy, it kind of becomes a hammer and an anvil. It works to kind of pincer that cell, cancer cell, preventing it from being able to divide. And we're seeing that as a game changer for a good percentage of patients, particularly triple-negative patients. We're seeing patients with disease control out beyond a year, 18 months in a certain subset, which is something we've never seen before. So it is certainly an exciting forefront of medical oncology.
It's absolutely remarkable. And it's some great news, gives hope, much needed hope. Well, I just want to say, for me, the takeaways that came out of this are that knowledge is power. Know yourself, know your doctors, and communicate early and often. Don't delay. And I just cannot thank Dr. Dang, Dr. Smith, April, all of you are incredibly grateful for giving up your time and joining us today. And to all of you who tuned in, thank you for watching. I hope that you're more empowered to take charge of your health and to build that strong rapport with your provider. Do not be afraid to ask questions or record. That was such a good tip. And just to be open and honest at all times. And just really, really grateful to all of you. And I do just want to say a huge thank you to City of Hope of Orange County for bringing this panel to us today and for their partnership with Komen Orange County. For more information about what is happening with their expansion into our community, go to cityofhope.org/OC. And I think we do have a slide. The best way to keep track for both organizations is on our social media. So whatever platform you prefer, we're on Facebook, Instagram, Twitter, at Komen OC and at City of Hope OC. And we're going to be sharing a recording of our panel discussion today on these accounts. So feel free to share with family and friends who couldn't tune in live or rewatch it yourself for more nuggets of information. But everyone, please stay safe and cool. Drink lots of water during this heat wave, and hope you have a great rest of your Wednesday.